Hello everyone, I'm the reporter Fan Shuangrong. Now I'm going to introduce our research, a scoping review of clinical unstructured text information extraction. First, let's move on to the first part, background. In recent years, electronic health records have rapidly spread internationality. Many medical institutions have begun to adopt EHRs, which has caused the amount of data in EHR to rise sharply. EHR contains a wealth of medical research information, which makes people more demanding for EHR applications. However, since many EHR documents are in free text form, this unstructured EHR test may not provide a completed description that can be obtained from structured data. As a key component to promote the use of EHR, the information extraction tasks, extracting and encoding clinical information from tests, has an increasing demand. At the same time, EHRs continue to be popular in China, and the EHR data is continuously accumulating. However, at present, because most international studies use English, the research on IRI mainly revolves around the English language. IRI research on Chinese requires more effort. This is where we still need to work hard. Furthermore, because Chinese is more complex than English, it requires more effort and cost to research. As a country with a large population, the development of electronic health records in China is considerable, and is a research field with great potential for development. In order to further understanding the progress of information extraction in China and abroad, so as to better conduct the research of IE in Chinese electronic health records, we summarize this review. Next, let's come to the second part, method. We use keywords information extraction and clinical test, narrative test in 5 databases, including IEE and Web of Science, to conduct literature research. A total of 643 related literatures were searched. After searching, we removed 20 reactivity articles and 434 articles that were not IE or clinical relevant. At last, 189 clinical pieces are left for the results. The 2 authors of this article have read and sorted all the articles from 5 aspects: problem definition, data pre-processing, knowledge-based establishment, method training and testing, method practical application, and on-grade iteration. The 2 authors read the first 20 articles at the same time, and after the identification and sorting methods of the 5 aspects were established, the author bound articles completed the reading and sorting of 69 of the remaining 169, and Fan completed 100 of them. Next, we will discuss these 5 parts one by one. No. OK， 重新开始吧。Next, we will discuss the results from these 5 parts one by one. The selected 189 articles were divided into 5 categories according to the use or purpose of their information extraction, including decision support, information retrieval, struggling of information for secondary research, various types of information extraction, and reading of non-English language literature. Under the above extraction purpose, we have a summary of the information extracted for each purpose. Among the information extracted from various studies, we find that strings or words extracted mainly depends on its application in reality. and the type of extracted information has its specificity under different purpose. Many of the articles selected use source test data that are public database, such as I2B2. The type of source test used in their studies can be roughly divided into clinical documents and non-clinical documents. The clinical documents can be roughly divided into two types: clinical records and diagnostic reports. Clinical records are patient documents provided by medical institutions, which generally include the patient's medical history, physical examination, clinical observation, summary of diagnosis and treatment procedures, and treatment plan. Diagnostic reports refer to documents produced by diagnostic services, such as radiological reports, laboratory reports, and pathological reports. Non-clinical documents mainly include data collected by social media such as Twitter and other social software or websites, as well as medical literature searched in various databases. Before using the computer to extract information from the obtained database, many studies will first mark a gold standard. Among our selected articles, 31 mentioned that their methods are labeling the database in manual labeling. When manual labeling the database, it's easy for individuals to make mistakes due to negligence or improper understanding. If at least 2 people are used to label and compare their labeling results, it can effectively reduce personal labeling errors. In the research we have completed, 12 studies are annotated by 2 or more people at the same time, and 4 articles published the labeled consistency results. 2 articles published the k-value of their labeling results. The methods of clinical IE can be roughly divided into 2 categories: rule-based and machine learning. Here we mainly discuss machine learning methods. Machine learning is a learning process based on existing experience to make successful predictions, and is currently very popular in many fields. Machine learning generally includes 2 steps: feature engineering and models fitting from scratch or using tools. Feature engineering is an important step of machine learning. We have completed the features used in the articles. Among them, the more commonly used features are part of speech, n-grams, words, fonts, position, semantic feature, window size, punctuation, and so on. In addition to most used features mentioned above, there are some features that are used for the information to be extracted. For example, when extracting event information, time information, and their relation information, features such as verb tense, character type, sentence type, time expression type, and event mention attributes are used. When extracting radiological report information, stemming, normalized, anatomic location features, relative features, similarity features, and so on. Punctuation marks, verb tenses, and title were also used when extracting information from discharge records. Comparing the extraction information and features of various articles, we also found that when extracting entity information, people tend to use features such as drug-related information extraction, time extraction, protein interaction extraction, tumor information extraction, and so on. In various studies use features for information extraction, the lowest F-value is 0.66 and the highest is 0.09. Summarizing the IE algorithm of 189 articles, we can find these 6 methods that are more popular with researchers. At present, compared with English IE research, Chinese IE research can have more efforts. A total of 14 Chinese documents were included in this study. After sorting these documents, we found that few research results of Chinese information extraction may be due to the following reasons. First, lack of available data. At present, the clinical data of many institutions is not available, or only available internally due to considerations of patients' privacy and safety. The lack of data makes it difficult for technical talents with ideas to conduct research. To solve this problem, the most important thing is to promote data sharing and establish some public datasets for the convenience for the researchers. Second, lack of technology. In consideration of the safety of the medical system, the current clinical data is mainly available to the person inside the hospital. But these insiders lack sufficient information technology, which makes independent research too difficult. Those who understand related technologies do not understand clinical knowledge and lack sufficient clinical work experience. Currently, clinicians and technical experts do not cooperate well. China has realized this problem at present, and multidisciplinary cooperation and the cultivation of interdisciplinary talents are gradually being carried out. Third, differences in electronic medical record systems. At present, not all Chinese hospitals use electronic medical record systems. Some more remote hospitals with back technology have not used or established electronic medical record systems. Moreover, even hospitals that use electronic medical systems have different system versions. This may be due to data security considerations, because the manufacturers of the system are different, and natural language and clinical sub-language used are different. It makes it difficult to gather data from various hospitals. We can see that the same hospital is using multiple systems for work. This is mainly because the contents of electronic medical record systems are inconsistent, which makes one system unable to meet the needs of clinical work. Fortunately, at present, the National Big Data Center has been established in China. Perhaps it can take the lead in designing and producing a sharp, comprehensive, and secure electronic medical record system. Fourth, the complexity of Chinese language, such as the diversity of translation of foreign words, multiple meanings of one character, and the diversity of clinical documents narration. These all brought many difficulties to extraction of Chinese clinical information. To solve this problem, it's still necessary to carry out multidisciplinary cooperation. Include Chinese language experts in the research team and teamwork to build a medical corpus. The current research on IE mainly includes three major areas: disease, drugs, time and events. Most researches on diseases are information extraction about cancer, including identifying cancer, predicting the possibility of cancer occurrence, and staging cancer. The data selected for these researches are mainly diagnostic reports. The current information extraction has made great progress, but there are still some common problems. The problem of entity information included the long expression of entity, the entity being not entirely a noun phrase, wrong judgment of entity type, and overtraining. The problem of relationship information include long distance between two target entities. Relation expressions exist in instances, but are independent of the target entity. Multiple negatives. From the perspective of language, Chinese IE has great research value, which also means that more effort and progress are required. However, Chinese information extraction not only has the above-mentioned common difficulties. Because the language is more complex, it also brings more problems, such as the diversity of foreign words translation, rhyme character with multiple meanings, and the diversity of clinical document narration. Chinese information extraction still needs more research. Thanks for your listening.